gonna discuss about stroke CVA. It's some kind of very common, overrated, but again, it will still show up in your examination, even if it's really overrated. So CVA, literally known as your stroke. Cerebrovascular accident. From the word itself, cerebrovascular accident, it's something about your blood vessel that deprives your what? So by definition, it's the decreased blood supply to your brain. So decrease O2, decrease glucose. That's the main mechanism here. So risk factors, there are two types of your stroke, by the way. So what are the two types? We have, for example, ischemic CVA, and that is by way of your thrombosis, and as well as embolic CVA. And shall I include here watershed stroke? That's your ischemic CVA. So when you say thrombosis, from the word itself, thrombus formation, that can be caused by your atherosclerosis. From the word itself, athero, it's a fatty formation that will bring about platelet formation. Later on, it will cause your fibrin. I'm gonna review about your clotting formation. How does your atherosclerosis and your arteriosclerosis bring about clot formation by way of your thrombosis? So basically, atherosclerosis is increased cholesterol. When you say atheroma formation, it's formation of your cholesterol deposits or lipid deposits inside your blood vessel. When you differentiate the two, when you say arteriosclerosis is basically hardening of your blood vessel. So we have atherosclerosis and your arteriosclerosis with a little bit of spasm at the same time hardening, which will bring about injury to your blood vessel. If you have like an injury, there you go, there's a platelet again. If you have atherosclerosis, and then remember your blood is turbulent and your artery bring about a lot of pressure in your blood flow in your arteries has a lot of pressure, so chances are that atherosclerosis will dislodge, and that is where the platelet comes in. So I'm going to discuss to you about thrombosis related to your atherosclerosis and atheroma. If this is, for example, your blood vessel, for example, internal carotid artery. Why did I write this one? Because I'm going to trace the symptoms later on related to your blood vessel affected. When you say atherosclerosis, build up of your plaque, that's your atheroma formation. If this is, for example, internal carotid artery. So what's going to happen? Since high pressure in your artery, this atheroma formation here might dislodge, not necessarily dislodge, might tear down. That bleeding in that area, because your atheroma formation, remember, this is sclerosis. This is already part of your blood vessel already because this is chronic, right? It's progressive. It's gonna stick on your blood vessel. Once this pressure will tear this down, it causes injury to that portion. There's a platelet coming in, primary hemostasis. And the secondary hemostasis, the byproduct is fibrin. So fibrin is a byproduct of your secondary hemostasis, cementing the clot. So this is platelet and this is your fibrin. So that will cause significant blood supply compromise to your brain. And if you talk about blood supply, that contains oxygen and your carbon dioxide. Same thing as with your arteriosclerosis. Even without this thing, your blood vessel is already like hardened. And this hardening causes an injury because of too much pressure. And that injury will cause you to have like platelet migration. At the same time, fibrin formation in that area. Significant blood supply will be impaired. Decreased oxygen, decreased glucose as well. As you all know, oxygen is very dependent at the same time your glucose. Your glucose is consumed by your brain for about like 70 to 75%. That's a lot of glucose being consumed by your brain. Okay, when you say embolic, most of the time it's AFib. Okay, atrial fibrillation, embolic. So if your clot formation will travel, this is your heart. If you have like AFib, for example, when you say AFib, atrial fibrillation, there's no electrical impulses in your atrium. If there's no electrical impulses in your atrium, what's going to happen? It will create clot. Remember, your blood is naturally viscous. Chances are it will thrombus to your, probably to your pulmonary circulation, or pwedeng mag-throw ng embolus yan to your brain. Plus, the fact that you have ASD. This ASD, this septal defect here, will have an access to your atrium. At the same time, your aorta. If it gives access to your aorta, so these clots here will go here to this defect, to this hole, and it goes to your aorta and it goes to your brain. So that's another thing. AFib, clot formation, because your blood is naturally viscous and it goes to your brain. It could go to your pulmonary vasculature, and it could also go to your brain as well. If you have like ASD, an atrial septal defect, if you have like formation of clots in your atrium with a coexistent AFib, it will simply aggravate the problem. That direction from your atrium to your aorta, because of that hole, that embolus will travel to your brain, causing impaired circulation. So watershed, I'll just explain it later when you say watershed in terms of your symptoms. It depends upon which area is affected in terms of watershed. So ischemic, the other one is your hemorrhagic. Your hemorrhagic CVA is brought about by aneurysm. Okay, if this is your blood vessel, for example, an aneurysm is like this, an outpouching. We call it as one type is your berry aneurysm. The other one is AV malformation or arteriovenous malformation. So when you say arteriovenous malformation, if this is your artery, for example, the small arteries are what we call as your arteriole, and then this is your capillary, and this is your venule. Venule is what? Small veins. Arteriole is a small artery. And this is your capillary where exchanges happen. So if there's too much pressure here, it will exert more pressure to your capillaries. And capillaries are small. These capillaries are very small enough to handle the pressure. It might rupture. It might cause bleeding. An aneurysm can rupture. It can cause bleeding as well. So aneurysm is not a form of AV malformation. AV malformation is different. So if you think about these things, thrombosis, embolism, aneurysm, AV malformation, increased pressure, collectively, in terms of etiology, he's talking about hypertension, you have your smoking, and these are lifestyle kind of risk factors, especially hypertension. Chronic kind of hypertension, it can cause ischemic CVA, it can cause arteriosclerosis later on. And hemorrhagic, it can cause aneurysm because of too much pressure, it will create aneurysm, and an AV malformation. And eventually it will rupture, it will cause bleeding. An aneurysm can be in two forms. It can be a subarachnoid hemorrhage. It could be an aneurysm in your subarachnoid, and it could be, when you say subarachnoid, it's in your meninges or intracerebral. So this is what is I'm drawing. That's your intracerebral. The aneurysm is not found in your meninges, which is subarachnoid. The aneurysm is found in your intracerebral artery. So it will cause you to have bleeding. Most important structures in your brain are what? Your brain, CSF, and your blood vessel. Again, brain, CSF, the brain tissues itself, and your blood vessel. Brain tissues, CSF, and your blood vessel. Anything to do with these factors or tissues will cause you to have problems in your brain. That is where the symptoms arrive, especially increase in your intracranial pressure. So let's move on to your mechanism. In terms of mechanism, it goes like this. Okay, mechanism, before we'll talk about your signs and symptoms. Your mechanism is, as I've said, decrease O2, decrease blood sugar. If this is deprived of oxygen, for example, in this area here, because of following factors that I mentioned, basing on what the type of your CBA. If this is deprived, decrease oxygen and your glucose. Decrease oxygen and glucose, what's going to happen? Going to happen is that, remember, O2 and your glucose is needed in the synthesis of your ATP. Decrease ATP. ATP is basically your fuel for everything in terms of metabolic process. This is talking about neurons already. If you don't have ATP, everything is useless. Your action potential is useless. Your neurotransmitters are basically useless because they're not able to process chemicals that are needed in your action potential. They're not able to process your sodium, your potassium, your calcium. You're not able to process your neurotransmitters. So if you have less ATP, what's going to happen? Increase glutamate. This is again another problem. So glutamate, as you all know, glutamate is very abundant. So this is an excitatory neurotransmitter. If you do not balance it out, it's gonna cause damage to your brain tissue. If this is your blood vessel here, which is deprived of oxygen, this area will be deprived of oxygen, whole area, and that's because of your glutamate. It's in your glutamate. Your glutamate will also stimulate what? So basically, this will cause damage, and it will also trigger your apoptosis. Damage and apoptosis. What's apoptosis again? Cell suicide or a programmed cell death. In general, when you say apoptosis, is if a tissue is not anymore useful, they are programmed to die. Just like in cancer, if they're not gonna die, these are dysfunctional already. So magkakalat ng lagim. Just like this thing, this glutamate will trigger apoptosis. These cells are not yet ready to die, but because of this glutamate here, they are triggered. So what's gonna happen? They are going to die, even if it's not yet their time yet, but they are dying. Say dying, that's a cell. It will eventually lead into cell necrosis. So the problem here is glutamate. That's because of decreased oxygen, decreased glucose, decreased ATP, the increase in your glutamate level. You're not gonna process it because everything is useless. And this glutamate, as the most abundant excitatory neurotransmitters, will exert its effect. It will cause damage and apoptosis to your tissues. That's the mechanism of your CVA. That's specifically if you talk about clots. So yeah, it's also going to happen in your bleed, but in terms of bleed, there's a little bit of difference. The fact that this one is ruptured, for example, because of aneurysm, what's going to happen? The blood will seep out to that blood vessel. So what's going to happen is that there is a direct effect of your blood towards the tissues. What's the direct effect that I'm trying to say here? There's always a direct toxic effect of your blood if it's seeping outside of your blood vessel towards the brain tissues. The toxic effect of your drugs, because it contains toxins as well. So the byproduct of your RBCs, your WBCs, it contains also toxins. Metabolic products will kill your brain tissues. So that's the problem also in your CBA, but in your hemorrhagic CBA. And another thing is that, remember, that's blood. It's a fluid. If it says like if it's a fluid, it means to say it can cause increase in your fluid volume. Increased ICP will happen. So if you think about it, hemorrhagic is more fatal than your ischemic CBA, because you will undergo many processes in your ischemic CBA. Well, in fact, in your hemorrhagic CBA, it will only take like a direct effect of your blood to your tissues to cause an effect. So this is more damaging. This is about 25%. This is about 75% of incidences. So let's talk about the signs and symptoms. So if you see here, the drawing, this is your blood vessels, the blood supply in your brain. So I choose this drawing because it says a lot. This is your internal carotid artery, which supplies actually almost everything, because it comes from here, from your aorta, internal carotid artery. Of course, this is only the left side, and you also have your right side. I mean, your left internal carotid artery, and this is your vertebral artery, ophthalmic artery, anterior cerebral artery. We have your left and right. Middle cerebral artery, which is the most commonly affected, which is left and right as well, and posterior cerebral artery, left and right. And I should say that's it. That's the most common arteries that are involved in your CBA. So if you look at the signs and symptoms, that's based on the arteries involved. If the internal carotid artery is affected, this is what? There's too much damage here. And this supplies your brainstem. I shall include here the vertebral artery. So if you have like a brainstem affectation, what's gonna happen? Heart rate, the heart and your respiration. So cardiorespiratory problem will happen. The internal carotid artery and vertebral artery, which is not as common as your MCA. Your mid-cerebral artery, it affects your what? Symptoms are usually talk about speech and as well as hands and arms. So I'm gonna make a drawing here. This is your MCA. There you go. This is a face, an inverted person with the legs. So if you look at this one, in your MCA, the head is being illustrated there. So speech and hands affects this particular portion up to here, because the blood supply covers this portion here. And to the intricate arteries down towards this portion here, it can also be affected, and as well as legs. Remember what I told you about this portion here? Somatosensory, sensory function. If it talks about sensory function, particularly your hands, arms, feet, and legs, here, there's your paresthesia and numbness, and as well as weakness. So that's your MCA. When you look at your anterior cerebral artery, it talks about your what? It talks about, I'm gonna draw this one as another person, which is, so it's more on to your, I'll just write here legs, your feet and legs. This is more onto your motor. Remember, the portion here is motor cortex. Again, what's parietal? Sensory. When you say frontal cortex, that's motor. So functions related to your feet and legs in terms of motor, it's more onto your weakness. Here, it's more onto your sensory. This one is more onto your motor weakness. Here, there's a little bit of weakness because sometimes it's overlapping as well, but it's more on paresthesia or numbness. Here, weakness and inability to move. So basically, it's weakness. So that's ACA. When you look at your posterior cerebral artery, this is going to be your visual. When you look at your basilar artery, it contains cranial nerve, signs and symptoms. Because your cranial nerve is mostly coming from your basal. Talk about MCA as well. Don't forget your Broca's. Your Broca's is located here at the portion of the frontal cortex, and the Wernicke's area is also here in your temporal area. But your MCA is also responsible in supplying blood, oxygen, and your glucose to your Broca's area. So Broca's area and as well as your Wernicke's. What did I mention about this Wernicke's and your Broca's area? When you say Wernicke's area, you are not able to comprehend it. It means to say if you have like aphasia, that means to say that's receptive aphasia. Your Wernicke's area will communicate to your Broca's. For example, if somebody's going to ask me my name, what's your name? So I heard it on my temporal. Remember, temporal is auditory, and then it was comprehended by my Wernicke's area. So my Wernicke's area will tell my frontal area, particularly your Broca's area, to tell my name. So my name is blah, blah, blah. If your auditory area is being affected or your temporal area is being affected by CVA, you will have like a receptive kind of aphasia. You would not understand what is being told by that particular person.